Hi everyone, I'm Megan Hill from the Harvard Project, and I am here with my friend and colleague, Randy Akee. Randy, I wonder if you might introduce yourself.
Yep. Hi everyone, I'm Randy Akee. I'm an associate professor at UCLA in the departments of public policy and American Indian Studies. And I do research on indigenous peoples in the Pacific, in the Americas, and yeah, I think primarily those general areas.
Great, thanks. I'm so glad you're here today. So yesterday, the UCLA American Indian Studies Center, of which you were a key part of, released a really interesting interactive tool showing the rates of COVID-19 by tribal nation. I'm wondering if you can tell us a little bit about that, why it's important, how the data was sourced.
Great. Yeah, so we, in collaboration with the Bunche Center at UCLA, which is another research center at UCLA, put together the data that actually exists and is compiled by Indian Country Today. And they've been doing that for about a month or so already, which is fantastic. So they've gone out and they've sourced all of the data from public reports of natives in the US, Alaska, as well as the lower 48, and gone back and verified and checked with administrators on tribal reservations in community health organizations that these are people from their communities. And then they've put that data up for public use on their website. So it's a fantastic resource, and they've updated it almost daily, like I said, for the past about 4 weeks, maybe even longer. So all we did was we took that data and we put it into a graphical format. So you can see the sort of progression of COVID cases and deaths. They collect both pieces of information by days over time for natives as a whole, and compared to state rates. And so state rates meaning the full population in a state like New York or something, case rates. But most importantly, we were able to put together a single interactive graph that allows you to look at tribe-specific rates, case rates, where data exists. So there's a lot of a lot of tribes that have no information, which we take hopefully as a good sign that there's very low incidence. On the other hand, there may be not a lot of reporting in some communities. And so as best as the data we've got, that's what's up there right now.
Yeah, it's incredible, this idea of open source data. I mean, it really tackles head on this issue of invisibility of native populations. And so being able to sort of use the data to show where the hotspots are, which tribal nations are being impacted, that doesn't always come through some of the media that we hear, and how it's related to states.
Well, and that, I think you sort of hit the nail on the head, and that's one of these issues that communities, native, indigenous, small populations in general are feeling in the United States, sort of being part of the asterisks, the other or the unreported community, because even in at the state level, departments of public health are sometimes unable to report these smaller groups. Some of the bigger states can. I live in California, and we do a pretty good job here, but some of the other states, the incidence levels are small, which again, not a bad thing, but however, it is difficult if you are trying to track trends across time for these groups if you're just not being counted. And so this service by Indian Country Today is just amazing. And so we feel like we've added just a little bit more to that by having the figures so that you can see it graphically. But it argues for the importance of data disaggregation, accurate reporting about race, ethnicity, especially in vital statistics going forward. And we know that we're sort of in unfortunately just the first phase of this pandemic, but this argues for us, all of us, politicians, academics, community members, to really advocate for better collection and articulation of race, population, ethnicity, tribal citizenship, reporting in these efforts, because this is going to be the way that we get that information across to everyone.
Yeah, absolutely. I know this is preliminary, but can you maybe share any trends that you're seeing in this data, anything surprising, or even maybe any correlation between governmental interventions and whether by the tribal government or the state and case rates? Is there anything we can say?
So we've used this data. So a couple of colleagues and myself have used this data, and we've actually linked it to census characteristics, so characteristics at the reservation level. And we found two really interesting points, and we've just recently got that published in a public health journal. And what we find there is that the highest incidence of COVID-19 are essentially related to the proportion of households that do not have complete plumbing, which makes perfect sense in a pandemic that's related to the ability to wash one's hands. The second thing that we found that was quite interesting from our perspective was the fact that higher incidences also were related to, well, negatively the opposite, related to the proportion of households that don't speak English, sort of on reservations. So sort of suggesting that maybe some of these public health warnings and directives are only being promoted or provided in English or maybe a few languages. And so again, it suggests maybe in future going forward, the way in which public directives and public health directives need also to be translated into local languages. So those are the two really big things that we have found looking at this. We're looking at a third thing that I just started some work on, which is census response rates. So the Census Bureau provides real-time data on response rates to census, which we know is going on right now. And for instance, the Navajo Nation, which we all know is being unbelievably impacted by COVID-19, actually has one of the lowest response rates, self-response rates in the census right now, something less than 1% from the data that we have. So that's problematic. It's an issue that matters because the normal remedy to low response is to send people out and to knock on doors. And that's going to be even more problematic when you have a public health pandemic like this. So this may compound issues that already exist in Native communities of undercounting and may make it even worse. So we're just starting to get some data on that, and it's looking dire, unfortunately, in multiple realms, of course.
Yeah. I mean, we need to be counted, and it's going to take some new and innovative approaches to sort of think through that for Indian country, for sure, because we're already underrepresented.
Yeah.
Right? So how do you think tribal nations can utilize this tool? How should they be thinking about it? How should they be engaging with it?
Sure. I think, it's one piece of information. It's, as I mentioned, it's as good as the data that we have. And, this is better than, I think, some of the state level data that exists out there because it's so aggregated, or again, individuals are misclassified as a different race, for instance. So to some extent, I think this is useful data for tribal governments, tribal health offices to just get a baseline sense of what's going on in the communities. And we'd hope that they'd, augment it by contributing their data to Indian Country Today when and if, more cases arrive or show up to keep that sort of continuity in terms of data sources. So that would be useful. I think, again, I think, we're going to look back historically on this and understand impacts, and it may also help us in the future to figure out ways of combating or creating policies that improve what's going potential future epidemics or viral infections like this. So I think that potentially, again, this is a useful piece of data that individual communities can look at for themselves, but also in relation to the outlying community, the states, the counties that they live adjacent to, because we know that the contagion happens across, and sort of pinpointing the dates and the ways in which transmission occur, I think are going to be very useful for us going forward.
Yeah, that's right. It's really, it's an eye-opening tool. It's incredible. Really, thanks to you and the entire UCLA team. Before we sign off, are there any sort of last thoughts you have?
No, I hope everyone stays safe, and I'm hopeful for better data. We all are, and looking forward to helping to others make good policy decisions in the future on this.
I agree. Thanks, Randy. I appreciate you spending some time with us, and we'll talk to you soon. Stay safe.
Okay. Take care. Bye-bye.
You too.